Here's our host, Tian Wei.
Hello and welcome to World Insight, coming to you live from Beijing. I'm Tian Wei. Let's begin with the coronavirus outbreak in China. The death toll now stands at 493, mostly in Hubei Province, ground zero of the epidemic. The nation's total number of confirmed cases is over 24,000, with more than half in Hubei. On Wednesday, nearly 4,000 new cases have been confirmed across the country, while about 1,000 people have recovered nationwide. Beyond China's border, the virus has spread to 24 other countries with a total of 193 confirmed cases. The World Health Organization plans to send a team of experts to China as early as this week, according to the latest report, to help halt the spread of infection. Earlier, I talked to Dr. Gauden Glea, the WHO representative to China, days after he came back to Beijing from Wuhan. Let's take a listen as to what he had to say. And for more on the outbreak of the coronavirus, we are joined by Dr. Gauden Glea, or Gao Li, his Chinese name is, who is the WHO representative to China. Dr. Glea, welcome to our program.
Thank you, Tian Wei.
Thank you so much for sharing your time. I know you have a very hectic schedule these days. Tell me more about the latest assessment of WHO of the outbreak of coronavirus right now as we speak, sir.
It has been declared a public health emergency, which means that all countries need to get ready for it. At the same time, the mortality rate has settled to around 2% of known cases, and that is a far lower number than it appeared at the beginning.
What do you make of the latest situation and even mistreatment of Chinese and people who wear face masks elsewhere in the world? We've seen increasing numbers of stories like these recently.
Every country has its sovereign right to make its own public health risk assessment and to decide what actions it will take to protect its citizens. WHO did not make any travel or trade restrictions based on the evidence that is available, because it understands that there are ways in which countries can protect themselves through increased surveillance, through increased laboratory and clinical readiness, through appropriate risk communication with their populations. So the balance has to be reached between the overall costs to the global society, global economies, and the public health risk. Hopefully, over a short period of time, a balance will be reached that is reasonable and minimizes the cost.
Has WHO, on the other hand, Dr. Glea, providing advice to those countries what WHO consider as overreactions, or already reacting in a way as if it were a global pandemic? Because WHO already said it very clearly, it is not yet a global pandemic.
Under the international health regulations, WHO is empowered under Article 43 to receive from the countries concerned their public health rationale. It will be assessed by WHO, and communications will go back to the countries concerned through, again, the internal peer review that is offered by the international health regulation. WHO does not have the power to judge or to decide on an individual country, but it can point out what are the alternatives that there are, and it can provide an assessment to those countries on the appropriateness of the public health rationale. This is well within the agreed international health regulations.
I see.
And that is a process that is already ongoing within WHO.
With what countries can we share here?
Of course not. This is the international health regulation is a peer review within the process within the network of international health regulation focal points.
Dr. Glea, apart from the WHO's assessment of the latest situation of the outbreak, he also explained to me in detail in that exclusive interview about the timeline, the efforts made by the medical staff, and also the locals in Wuhan, the epicenter of the outbreak, as well as the significance of global cooperation on combating the spread of the coronavirus this time. Welcome back. Let's go once again to the latest outbreak of coronavirus in China. We continue our conversation with Dr. Gauden Glea, who is a WHO representative to this country. He's on board with the Chinese government's efforts to control the spread of the coronavirus, and he praised the medical community for their hard work since the outbreak. But he also reminds us to think twice about taking drastic decisions such as locking down cities and carrying out restrictions on people's daily lives. Let's listen in to my in-depth interview with him. This is your first day out of quarantine after your latest visit to Wuhan. So tell me more about this timeline, how WHO was informed, and how you've been checking on the information and the latest prevent and control situation.
The Wuhan government issued a notice, a public notice of the recognition of a outbreak of a cluster of atypical pneumonia at the end of last year, specifically on the 31st of December. We were immediately alerted by that, entered into a rapid discussion with the National Health Commission, and shortly thereafter, on the 3rd of January, our own office met with the National Health Commission, and there was an international notice under the international health regulations. Since then, the progress has been on a number of lines. We have had regular meetings with the National Health Commission. So we have, as the National Health Commission has compiled the data and is able to provide a new milestone of understanding, we get that delivered to us, and we are able to spread it through WHO. Equally importantly is the laboratory side, where within days of the initial recognition of the cluster, the virus was identified, and by early January, there was the release of the genome sequence that identifies uniquely the virus and allows scientists around the world to start developing test kits.
I see.
Later, China has also released the probes and primers that are used by the technical specifications that allows other countries to be even faster in the development of the reagents they need in their laboratories.
Dr. Glea, many people are interested in knowing what about the human-to-human transmission. When does WHO know about that possibility, at least, with this latest outbreak, and how you've been coping with that, and how you've been cooperating with your Chinese side, or interacting, if I could use another word, about that?
In the very first cluster, it was either people who had an association with the Huanan seafood wholesale market, or contacts of those people, stallholders and workers inside the market. There were already a number of cases that were not associated with the market, and so the suspicion that some human-to-human transmission had taken place was happening very early. But then between that and sustained human-to-human transmission, it is a technical question that's very difficult to answer, and especially the investigation of clusters gives us some of clusters of cases gives us some understanding that this might happen. It is only towards the end of January that evidence had accumulated, including by some examples of clusters of transmission that had happened outside the country. And that was one of the core elements that precipitated WHO to declare an emergency, a public health emergency of international concern.
I see. Dr. Glea, when you say about the measures taken by Wuhan, because you were there in January, tell me about exactly Wuhan has been doing it, and how should we see the pros and the cons of the measures being taken so far?
My visit and my team's visit to Wuhan happened just before the controls about travel in and out of Wuhan happened. So even when we were there, we even saw how the airport was operating its exit screening and the operations of the airport and the train station. Lasting impression of Wuhan is of the dedication of the workers there. We visited Zhongnan Hospital, and in the 2 weeks before we visited, they had processed 2,000 people to identify out of them 13 confirmed cases. We must admire the dedication of the workers and respect the sacrifice of Wuhan and other cities that have gone into this sort of social distancing. We understand, as from the evidence point of view, that social distancing, reducing as much as possible the numbers of contacts between people, is an extremely promising way of controlling and breaking the transmission. It remains to be seen how effective that has. It is safe to say that this will, to a high degree of probability, have reduced the peak of the epidemic. It will mean that eventually the numbers that could have happened without such measures would have been far higher. Whenever you do a dramatic public health intervention such as this, one always has to balance the personal freedoms versus the public health imperative. When you do surveillance, you have to look into people's data to understand who they are and what type of disease. Normally, this is data that people hold confidential, but it must be shared between the workers in order to be able to analyze the patterns. People's freedom of movement, people's ability to function and work in society are curtailed. And so against that and the economic impacts that will result, one then balances the public health greater good. One of the things that we can see is that the actions taken in Wuhan and in China as a whole have been recognized by WHO as having contributed to the protection of global health. We are seeing cases outside China, but it is safe to say that without the measures that have been taken, both locally as well as nationally, we would have seen a much larger spread.
But what about, Dr. Glea, the people from Wuhan to the other parts of China already? Now there has been also very strict registration measures being taken, as well as various cities and localities in China looking for those people coming out of Wuhan. So what do you make of, once again, this balance that you just beautifully touched on?
One needs to understand that now it's important to not artificially label people, because that could lead to a sense of complacency. What do I mean? If one looked at this as a Wuhan problem or even a Hubei problem, then one could artificially relax one's attention. So not only is it important for us to practice solidarity, and to avoid stigma. But it's not just because it's a nice thing to do, but because if we label the disease as being an issue of Hubei or of Wuhan, then we forget that now about 1/3 of the cases that are reported are outside Hubei. The issue is importantly to be seen as a China issue, and we should respect Wuhan and Hubei for the sacrifices they have made, but keep our vigilance up across the whole country.
WHO has vowed, as a result of announcing fake, to help those countries with weaker healthcare structures. One could think about the African continent, for example, or elsewhere in the world. Tell us about the latest efforts being made so far, how you've been coordinating, and what help have you provided, how to avoid the spread of the virus to these parts of the world.
We have immediately, the alert came to us. The same day, we had a 3-level incident management team set up with coordination between headquarters, the regional office in Manila, and ourselves in the country office. This 3-level team has continued to operate, and it's one of the most recent manifestations of that is the Director General himself, as well as the regional director of the Western Pacific region, coming to China to really represent a 3-level discussion about both what China is doing and what are the implications for the rest of the world. WHO has already on its website a very rich set of resources, has collected all the evidence from China, all the findings that are probable guidelines based on other coronaviruses such as SARS and MERS. This guidance is being updated on a daily basis as soon as new information. On the basis of a global effort, there's a mass mobilization of scientists and of public health experts to assist countries. Now that the public health emergency has been declared, all the country offices, like my own peers in other countries, are working with ministries to get their own readiness plans, how to strengthen their surveillance, how to prepare isolation units, how to achieve good supply of personal protection equipment, how to train their nurses, how to communicate the risk to their populations. So this is now happening on an international level.
Yeah. Dr. Glea, I know you are running out of the time for this interview. Final advice from you, final words as well for our audience watching our program today. Latest advice for them to protect themselves and their loved ones.
Thank you for giving me this chance. With every emerging infection, at its very beginning, there's no vaccine and there is no treatment. So we have to base ourselves on the behavioral response. Scrupulous hand hygiene, avoid handshaking, avoid the contact with surfaces that might be soiled. Food hygiene, respiratory etiquette, use your elbows to cover nose and mouth if you're coughing and sneezing. Social distancing, reduce the number of meetings that you have with people, whether avoidance of crowds, avoidance of physical meetings in offices. If one can reduce these numbers of contacts, we have a great chance of interrupting transmission. And finally, if you use masks, use them correctly. Do not reuse disposable masks. Do not fidget about the face because the mask itself can then become contaminated with your hands. And make sure that your surgical mask is disposed of after every use. Our control, our hopes of stopping the epidemic now lie very strongly in keeping social distance and observing personal behaviors.
Dr. Gauden Glea, thank you so much for sharing your very precious time at this important time of a coronavirus outbreak in China. All the best to you and your team here in China. Dr. Gauden Glea.
Thank you so much.
Thank you, sir. WHO representative to China. Bye for now, sir. Thank you. Really appreciate it.
Bye-bye.